Good morning, sir.
Morning.
How are you feeling today?
Yeah, pretty fine.
Can I know your name, sir?
I'm Dr. Saikat Ghosh, consultant neurologist, attached to North Bengal Medical College as an assistant professor in the Department of Neuromedicine.
Wow. So all the way from there just to attend the conference, right?
Yeah.
So how do you feel that we have finally, we do have a month where we are wearing people for epilepsy?
Of course, like other days where we celebrate special occasions like Epilepsy Day or whatever, any other diseases. So we should be celebrating such months to increase the awareness among people, especially among doctors as well as patients.
Can we also say in other words that we are celebrating them for being so brave?
Exactly, exactly.
All
More
right.
appropriate.
Yeah. So on that note also, I would also like to ask you, what are the greatest myths you have heard in your entire career?
Many, many. I don't know which one to mention, but I've heard people, especially in the rural background, they once the patient suffers from epilepsy, they almost isolate the family itself, not only the patient. They isolate the family itself, that the patient has been, under the power of some superstitious power or some other evil power, and there are myths that people sometimes sniff shoes or some other,
Right.
very very awkward prejudices, and,
Right.
these are big barriers actually, and we need to overcome them.
Right.
So people are getting more aware.
Right.
The awareness have actually increased, and people are starting to know that this is just like any other disease, and hopefully we are on the brighter side of things.
Right. And also there are a lot of people thinking it's contagious. So what would you like to say to that?
It's not at all contagious. It's not at all contagious. Yeah, few seizures run in families, but that's a part of many things. It's just like hypertension and diabetes. It's just like any other disease, and since people are not that aware, so we need to increase the awareness. So by this method, of course, we will be trying to overcome the burden of epilepsy in the population.
And what is that positive message you would like to give to the people who are already suffering through it?
Don't panic. Consult neurologists. Start anti-seizure medications and try to comply. And you shouldn't stop anti-seizure medications unless your neurophysician advises you to do so. There's mostly long-term therapies which you shouldn't stop. And this is just like another disease.
Thank you so much for your words. It really helped our audience who's already listening to us. Thank you so much for your time, sir. Thank you.